everyone. Today we learn about appendicitis. This is the appendix and the introduction of the appendix. The appendix is the organ at the beginning of the large intestine. It measures about 7 to 50 cm long and 0.5 to 1.5 cm wide. And the appendicitis The definition of the appendicitis. Appendicitis is also called epithelitis, is the infection or inflammation of the appendix. And the causes and risk factor. There is no clear cause of appendicitis. Obstruction of the appendiceal lumen cause appendicitis. Mucus breakups in the appendiceal lumen causing bacteria that normally lives inside the appendix to multiply. As a result, the appendix swells and becomes inflated. The source of the obstruction include food waste, hard piece of stool, parasites, or growth that clog the appendiceal lumen. Enlarged lymph tissue in the wall of the appendix caused by infection in the gastrointestinal tract or elsewhere in the body. Bacteria, virus, fungi, and parasites can be responsible agent of the infection that lead to a swelling of the tissue of the appendix wall and include adenovirus, cytomegalovirus, etc. The cyclic change is called appendicitis. Due to obstruction, the appendix is swelling, increase the interluminal pressure, compression of vascular, and the bacterial invasion, and it causes appendicitis. The pathophysiology. Due to etiological factor, obstruction of the appendix lumen by fecolith. The fecolith means feces of human. Due to fecolith, the decrease of blood flow and mucus secretion. And the secretion of the mucus is decreased, that's why increase the intraluminal pressure in the appendix. And the vasocongestion cause decrease of blood supply in the appendix. The blood supply is decreased, that's why oxygen and nutrition in the appendix is decreased. And that it's necrosis and proliferation of the appendix. And the bacteria invade in the appendix easily and disruption of the cell membrane of the appendix. That's why the inflammation of the appendix is occur. The signs and symptoms: nausea, vomiting, loss of appetite, constipation, inability to pass gas, fever, stomach swelling, and pain. In the main sign and symptoms is pain. The pain is located in McBurney's point. Where is the McBurney's point? It is 2/3 away from the umbilicus to anterior superior iliac spine. Early sign of appendicitis. The guarding. Guarding occurs when a person subconsciously tenses the abdominal muscles during examination. Two types of guarding occur: voluntary and involuntary. Voluntary guarding occurs the moment of the doctor's heart touches the abdomen, and the involuntary occurs before the doctor actually makes contact. And the rebound tenderness. A doctor tests for rebound tenderness by applying hard pressure to the patient's abdomen. Pain felt on upon the release of pressure indicates the rebound tenderness. And the Rosin sign. Doctor tests for Rosin sign by applying hand pressure to the lower left side of the abdomen, and pain felt on the lower right side of the abdomen, means opposite side of the abdomen its pain is felt by relieving the pressure on left side, and it indicates the Rosin sign. This is the Rosin sign. And the arrow sign. Arrow sign is the pain felt in the epigastrium upon continuous pain pressure over McBurney's point. It is indicative of chronic appendicitis. Then psoas sign. The right psoas muscles run over the pelvic near the appendix. Flexing these muscles will cause abdominal pain if the appendix is inflamed. Doctor can check for show sign by applying resistance to the right knee as patient try to lift the right thigh while lying down. Obturator sign. The obturator muscles run over the appendix. Doctor test for obturator sign by asking the patient to lie down with the right leg, bend the knee, moving the bent knee left to right, require flexing the obturator muscles and will cause abdominal pain if the appendix is inflamed. And the Blomberg sign. The Blomberg sign, here the abdomen wall is compressed slowly, then rapidly released, and its presence of the pain, it means the Blomberg sign is present and is indicate the peritonitis. Then is a Blomberg sign and the diagnostic evaluation. Medical history and physical examination. Physical examination is done by the various type of sign we examine, like arrow sign, Blomberg sign, and Rosen sign. Laboratory test and imaging test. Then the management. First of all, the non-surgery management. Non-surgical treatment is include antibiotics and soft diet until the infection subsides. This may include a chronic of metronidazole at the dose of 500 mg 3 times daily with ceftriaxone or augmentin 1.2 gram 8 hourly give through the veins. And the surgical management. Two types of surgical management, surgical incision and laparoscopic incision. The step of open surgery. After administering anesthesia, the abdomen is prepared with antibacterial solution. A Meg Burns incision or transfer incision about 5 cm to 2 to 3 inch in the length is made through the skin and the layer of the abdominal wall in the area of the appendix. The tissue are dissected to locate the appendix, which is present in the right lower abdomen. Then remove appendix. The appendix cut from colon and suture are placed over the hole in the colon. If the abscess is present, then the pus is drained with drain machine. After ensuring complete hemostasis, the abdominal incision then is close the layer. Close the layer by the hemlock solution. The step of laparoscopic surgery. After administration anesthesia, the abdomen is prepared with antibacterial solution. The surgery begins with a small incision below the belly button in the skin crease, which allows the insertion of the laparoscope. Another 2 or 3 small incisions may be necessary to insert the laparoscopy instrument to dissect and remove the appendix. The appendix is reduced in the size by cutting into a smaller section before being removed through the small incision. The abdominal cuts are all closed with stitches. The removed appendix is thus sent to a pathological lab to be analyzed. And the nursing management, acute pain and the inference for infection, nutritional imbalance and the fluid imbalance are in nursing diagnosis, and it's your assignment. Thank you for attention.